Today, we're going to talk about case management, and either when you're working in inpatient setting or in outpatient or emergency room, case management plays a big role. So, for example, let's say that you're in an emergency room and a patient comes in and you have seen the patient and then you have decided on a disposition, but child protective services is involved, or a elderly patient has to be placed in a nursing home, or um, or any other outside agencies are involved. Case management plays a big role in facilitating those kind of services. So we want to understand their role, we want to support their services, and we want to work with them closely to get better patient care. In an inpatient setting, sometimes you have a patient who, like, there are guardianship issues, there are placement issues, there are finding a next level of care. All these things, case management plays a big role. And I know that psychiatry providers like psychiatrists or nurse practitioners get a lot of weight on like caring for the patients, but we don't want to undermine the value case management or social work staff brings to the table. In some cases, actually, I like them to lead the care because that part of like treatment is more important in some cases than medications. So usually, like when we are in inpatient, uh, we think about treatment in phases. Assessment phase, where patient comes in, you assess the patient, you create a diagnosis, you create a treatment plan. Then you have treatment phase, where the treatment of medications or individual therapy is going on. Then we put the patient in discharge phase, where case management plays a big role because the patient now is mostly clinically stable, but aftercare services and case management services or placement is becomes a big challenge or big thing which need to be addressed. So in discharge phase, case management take the leadership of the service delivery or helping the patient. And I take this back step and let them lead, so very respectful of what they bring to the table, and let's understand a little bit more about what they do. So when you think about case management, it's a coordinated process integrating treatment, social support, accommodation, financial service to meet individual needs. We think about medication and therapy, but there are a lot of other things like housing, like financial SSI, and social support, and like day care services, or um, uh, retirement home, things like that. There are a lot of aspects of care which case management plays a role. Now, when you think about um, other things, um, like in term case management models, you have first model of mental health, that is intermediate service model. This was the first model of mental health, and there is focus on evaluation and planning. And it coordinates service delivery and manages initial assessment. So this is the first model. Now, when you think about clinical case management, there is advanced therapeutic approaches, integrating clinical interventions, and providing direct psychotherapy, and emphasizing skill building. And then there is intensified management, where this is designed for severe cases and they have lower caseloads, and they need frequent monitoring and enhanced support. So you want to understand that, like, let's say that there is a patient who needs a lot of services and they have multiple medical problems and psychiatric problems, then you want to put them into intensified case management services and have lower caseloads. So now think about case manager's responsibility. When you think about their responsibility, you think about they have to assess the patient. What you mean by that is that you're providing comprehensive evaluation, identifying the needs, providing treatment planning, and then goal development. Then, after assessing, they coordinate the care with different facets of care delivery, like service integration. They manage the resources and team collaboration, and family is also involved. Now, when you have to monitor, you're monitoring with ongoing assessment and treatment compliance and progress evaluation and plan modification. So, um, then you're thinking about support also, where you're thinking about crisis management. If let's say that a case manager has 10 patients and a patient has a crisis, they can call the case manager and ask for support. They also skill enhancement. Let's say that one of the patient has some skill set. They might have been a plumber or carpenter or something. They're put into mentorship programs or things like that. They're also advocating for these clients and also provide with environmental support, whichever, like, if they're living in an apartment or something, how do we enhance their life? So the clinical, by doing this case management, what we see is there is treatment adherence because they have direct support by the case manager. Then they have decreased hospitalization rates, they have better symptom control, they have reduced crisis incidents, and then there is improved social functioning and increased independence and enhanced daily living skills and better community integration. So the goal of this case management is for you to understand is that how they play a role and how you work with them and how you can tap into their expertise to provide better care. It's not all about medications and psychotherapy. It's about providing a basic support system where the patient can tap into other resources to provide housing, food, financial help, skills, and all that. And these are the models which are used to deliver that care. I hope that helps.